time to talk to us. I'm so excited to finally be able to sit down with you. It's been a while, first of all. Let me ask you, how are things going? I can't believe it's almost, I'm not even going to use the F word, I won't even say it, but I think we're beyond 6 months into the new year. How are things going as far as your role in this environment, and how are things happening as far as the hospital itself?
Well, things are busy. Things are always busy at a hospital, and there's no let up. It's a 365-day a year operation, 24 hours a day. It's very interesting. There's something new every day, and I learn new stuff every day. I've been here for 30 years, but I love the fact that I learn new stuff every day. And I love the fact that I get to work with my colleagues with whom I've worked for many years and serving the population that I've known my entire life.
This certainly is, I would say, a family. Every workplace has a very family dynamic. Talk about, let's kind of transition. Where are things as far as patient quality, patient care, your services, your offerings, and your resources here? How are that going?
Well, as you know, we always pride ourselves on the variety of services we offer here at A.R. Gould. Aroostook County has about 70,000 people, and we're geographically isolated. It's 150 miles to Bangor, and we've always prided ourselves. Our board of trustees, we're all local people, all volunteers, have always given us at administration a very clear signal. If we can offer a service, if we can offer it with the highest of quality, which generally means with a certain volume, and we can do it on at least a break-even basis, we ought to work very hard to offer that service locally so our patients don't have a 300-mile round trip to Bangor or a 600-mile round trip to Portland to get those services. Because our community has a lot of older, sicker folks who have more issues with transportation. The weather doesn't cooperate in Aroostook County for many months of the year. So for a lot of our patients, if they weren't able to get these services locally, they wouldn't be able to get them at all. And when I think about things, I think about our primary care that we're very proud of, but I also think what really makes us stand out is our specialty care. Things like having a cardiac catheterization lab and a comprehensive cancer treatment center with a PET scanner and ability to offer radiation oncology with our linear accelerator, which we're getting a new one next year. And things like even the dialysis unit over on North Street. Those are services that you wouldn't necessarily expect to see in a hospital our size, again, but because of our rural geographic nature, our nonprofit status, and really the vision of our trustees, we're able to offer those services so folks don't have to travel far for services. Because sadly, in many instances, if people had to travel that far for service, they just wouldn't get the service.
Right, so. Exactly. But don't knock the fact that we're rural, that you're a rural hospital, rural community. Tout it very much so. These are good things, and we want to promote and let people know, yeah, they don't have to go Bangor South for these.
Oh, absolutely not.
They're really opportunities.
Absolutely. More than 95% of people who present here for service are able to have their needs taken care of right here. Fewer than 5% need to be sent on, and really for almost all of that, less than 5%, their needs can be met in Bangor. And so it's very rare for us to have to send a patient to Portland or Boston or anywhere south of that, because of the comprehensive nature of the care we give.
One of the huge resources that I feel go under the radar, an opportunity to highlight, is your patient portal. And that really represents the communication between patients and your healthcare staff, and interactive very much. Talk about that. And what has been the feedback? A lot of people and a lot of patients, I mean, do you take the feedback and kind of say, yeah, this is really great, let's improve upon this, or we should, someone suggested it and recommended this, let's try that?
Oh yes, absolutely. The patient portal is a growing part of our communication with our patients, particularly with younger patients, but also with older folks too. We live in a much accelerated digital society. We want information at our fingertips, and we want it available immediately. And the patient portal is a great way to be able to communicate with our healthcare providers. Again, it can get information 24/7, can communicate in near real time, and we have really a lot of very positive feedback on it. It's just the way it is. We have fewer papers and more digital communication.
Tell some of the other technologies that you have, since we're speaking about technology.
Oh, well, I guess we talk about our electronic medical record, which is more than just a big filing cabinet. It also directs and shapes the way that we provide care. For instance, the example that I always like to use, although it's kind of dated now, when people have a heart attack, we know that giving an aspirin, a simple aspirin that's been on the market for 100 years, can reduce the risk of death by about 25%.
Still,
yes. And We had a very good track record prior to the EMR of doing that almost all of the time, but with an electronic medical record, it's smart enough to know patients here, diagnosis is heart attack, aspirin wasn't ordered, and just gives a little flag to the provider to say, hey doctor, patient's having a heart attack, you haven't ordered aspirin. And in some clinical instances that's correct not to, but oftentimes it's just could be something that's overlooked. And so the EMR keeps us on the straight and narrow path to make sure we're following the path that the physicians dictate, because again, it gets its instructions from our healthcare providers. It doesn't. It's not a substitute for health, but it is a great tool to make sure that we don't overlook things.
Yeah, very, very much so, and that no hiccups actually go in the worst. So the best example would be that you're not mixing medications and making sure that people aren't mixing, because that's a huge one in other communities.
Yeah, we talk about barcode verification. Before a medication is given, the barcode is scanned to make sure that we're giving the right dose, the right medication to the right patient. That's an enormous safeguard that has just become part of our daily lives.
Talk about, but as much as we love technology, I'm a people person, and I think ultimately it goes back to making sure you have some type of a relationship with people. Where are you all as far as recruitment and bringing on new people and making sure you have adequate staff to complement adequate patient care?
Oh, absolutely. That's a great question. As you know, one of the greatest challenges we have in Aroostook County and in every rural area is with our declining patient population. Aroostook County, fortunately, has stabled off the last couple of years, and our population has remained fairly constant. But we are aware that we're an aging society too, and that's kind of hits us in healthcare as a double whammy. As we age, we tend to consume more healthcare, and as we age, we tend to drop out of the workforce. So at a time when we have an aging population, increasing demand for healthcare services, we have a constrained population of folks following along. So everything we can do that helps us to maximize our person-to-person interactions is greatly, we really need to explore every one of those. And I think about things like work from home options. Really, 20 years ago, there were almost no employees who were work from home. Today, that is a growing part of our workforce.
Well, that's a result, I think, probably one of the few positives from pandemic is that we realized that we could still connect even virtually and online and still get some amount of that work done.
Absolutely, and it allows the workforce actually to expand. We have a number of our work from home employees really would not be in the workforce at all if they weren't, and they have childcare or elder care issues or some other reason why working from home would really be their only option for them. So that really has enabled us to expand the potential pool of workers to help us. We also use technology judiciously, because again, healthcare is a very high touch operation. But when I think about things like reminder calls for about appointments, that would have been done manually years ago. Now it's done via an automated process. Again, folks like to be able to reach their provider and talk to them, and we certainly don't want to get away from that, but we want to offer people a choice.
But I guess traditionally, are there any more physicians or any particular, supportive healthcare staff that you've added on or plan to add on?
Well, we're always very busy in our primary care and in our specialty care. When I think about things like general surgery and orthopedics, we've recently added new physicians in both of those lines, and we'll continue to grow and meet the needs of the community.
How about nursing?
Nursing remains a challenge. The market has opened up a little bit. We had a heavy reliance on travel nurses, particularly during the depths of the pandemic. That we're coming out of that now. We have a couple of great local nursing schools that are turning out new graduates every year, and we are seeing some relief in the nursing labor supply locally.
I was going to say, let's kind of shift to the education and collaboration you have with local higher education institutions. Still working well?
Oh yes, absolutely. We are great partners with UMPI and UMFK and Northern Maine Community College. We literally could not maintain our workforce without them.
Yeah, because one key component of this particular issue is promoting how people may not realize it, but healthcare has a huge impact on workforce development, because Because it's healthcare, and workforce development and hospitals play a huge role in that. Talk about that.
Absolutely. We have more than 800 employees in a community of 70,000 people. So we are your neighbors. We are your friends. We are the people that live down the street. A.R. Gould and actually all of the local hospitals are major contributors to the communities in which they operate. And that's a double-edged sword. In some ways, that it's great to be able to contribute to the economic vitality of our communities. In another way, it may be a danger sign because healthcare is the largest employer in the community. That may be a little bit of a cautionary sign about the overall economic health of the area.
So what's next? Look into the crystal ball for us and tell us what's next.
I would like to think that 5 years hence, in 10 years, we're continuing to offer very high quality healthcare, probably in closer cooperation with other local healthcare operators, with other hospitals, with other outpatient providers, because we really are all in this together. Presque Isle is not just a name of our town, but it's the way we are isolated up here in many ways. We are almost an island, and we need to stick together and work a little more closely to serve the population.
It is, but there's some I'm going to end this conversation, and this is becoming a running theme that I've been doing with interviews lately, is talking about there's like a buzz right now. There's a vibe happening in the Star City right now where we're kind of really going in a really proactive direction. Would you all agree?
Oh, yes, absolutely. I think about folks moving to the area. I think that the pandemic was a wake-up call for all of us, right? And many of us realized that living in a large city wasn't necessarily for us. There are special pleasures of living in a rural area. My wife and I have lived here for our entire lives, and you just can't beat that hometown feeling with a new energy, new vibes. You look and see new stores open on Main Street. You look and see new things going on down at the park, down at the. I like to walk by the splash pad and just see the vitality of the kids there. It's very renewing to know that we do live in a vibrant community.
And we're so pleased that the hospital is a huge part of that. Thank you so much for taking the time to talk to us. We appreciate you.
Thank you.